So for the theme, the agenda, I'd like to dwell on the theme, and then the environment, physician-patient relationship, patient empowerment, and health literacy, guidelines and treatment options, compliance, and then related to health outcomes, and then a summary and recommendation. So recipe, according to Webster, is actually a set of instructions for making or preparing something para magluluto ka. Number 2 definition is a medical RX or a prescription, and a method to attain a desired end. Ano ba ang gusto mo after na makapagluto ka? So it's a metaphor. Perhaps the diseases would be hypertension, CAD being the top 2 diseases in the country. And then what are the certain dilemmas that we're facing right now? Perhaps this is the unmet need of the customer. Physicians as decision makers acting as chefs or cooks. Patients related to compliance and health literacy. Customers, these are our customers and consumers. And drugs, medicines, and overall care may actually be main dish or condiments to the whole equation. So let us now discuss hypertension, diagnosis, implications, compliance. Bakit diagnosis? I'm trying to imagine every day that a patient will come, Dok, hypertensive na ako, masakit ang bato ko. So parang one-sided, that the doctor is the only one knowing na may hypertension siya based on the GNC, and yet the patient does not know meron siyang hypertension. So there's a disparity. And sometimes, magugulat ka, si doktor, hindi rin alam ang tunay na definition ng hypertension. So I wonder why. Even in the diagnosis pa lang, nagkakagulo na. So how much more if you try to treat a patient? Now, bakit karamihan na namamatay sa hospital, believe me or not, is actually the compliance problem. Alam nila kailangan uminom ng gamot, and yet they do not take the medications. And we start to choose. In this time of age, when I have never been in this kind of situation, when the doctor's image have been tarnished or tainted, trying to defend yourself day in and day out, your intentions as a physician, I've never imagined so harassed, either by patients, by lawmakers, and trying to say that we are unethical. It is unbelievable. And we start to choose. Sometimes we pay so much attention to, let's say, your cell phone or your car, but the least amount of attention being given to the medication. Kasabihin ko nga sa'yo, yung pinakamura doktor ng bagay sa akin, hindi sasabihin yung pinakamagaling. So, may disparity ng konti. So, what factors do you consider in the choice of drugs? And if you give the same medication to your mom or your dad, what's good for your mom, perhaps it's good for your patient. And it talks about values and preferences. Now, physicians, ano ang pag-iisip ng doktor in this time and age? Because in order to influence the physician, you have to know how they think so that you know how they behave. Kasi kung hindi mo alam ang iniisip ng tao, paano mo siya may influence? And it's actually behavioral. And patients, how can you empower? In an 85 million population, the migration of the doctors, 50,000 doctors according to the PMA, and a ballooning population. And the government has a distorted conclusion that this country needs only cheap drugs. So how can you treat 85 million with 50,000 physicians? Then you have to empower every Filipino to take care of themselves without actually seeing a doctor. So kailangan itaas natin ang antas ng health literacy, hindi lang ng doktor, pati pasyente. So that on the receiving end, okay, the patients will actually embrace the concept of the physician. Ilan sa mga pasyente yung sasabihin, nakasirkulan sila, naka-abs. I'm nothing against those drugs. Pero sometimes our knowledge may konting disparity in our attitudes and practices. Physician or patient as well. So this is actually a provocative question na gusto kong itapon sa inyo lahat. Para maintindihan natin, how can we solve a problem? Knowing that we are physicians and we know how to diagnose a patient and perhaps translate it to another level, perhaps we can diagnose the healthcare system in general. Questions. What are the different roles of patients and physicians right now? Socratic ng konti yung aking lecture. Kasi according to Socrates, you can only know the answers if you ask the proper questions. Thus, greater patient involvement in treatment would lead to more efficient health outcome. Ibig sabihin, kung marunong ba yung pasyente, makakatulong din ba siya sa panggagamot? And what is necessary? And how can the empowered patient be motivated to achieve more efficient health outcomes? Alright. Now, some few slides on hypertension data. Hindi nagbago po kahit 50 years. In fact, in the most affluent countries of the world, hindi pa controlled ang hypertension. In the G7 countries, believe it or not, hindi nagbabago ang prevalence rate ng hypertension. It's the #1 killer, the most important reason why a patient would visit a doctor. Regarding awareness, it's very high in the G7 countries. But treatment and control, kumukonti. Even in the G8 or G7 countries. Hindi nagbabago. Bakit ang taas na level, pero awareness and control, may problema. Now, one slide to summarize everything. I'm sure with a lot of drug companies coming in day out and lecture, you'll be bombarded. Just one slide lang. And ito yung sinasabi nila lahat. With every reduction as little as 2 millimeters of mercury, that would reduce cardiovascular events by 10%. That's the general. So this is a meta-analysis of about 60 prospective studies, 1 million adults. And it would say that 2 millimeter decrease in the blood pressure would redound to a 7% reduction in the risk of ischemic heart disease mortality and a 10% reduction in stroke. So therefore, the higher the blood pressure, the greater is the risk for stroke than coronary artery disease. Pero mataas din po ang kanilang correlation. And we see that in private practice, that patients with hypertension may have actually seeing patients with coexisting ischemic heart disease. So magkalapit. So therefore, the bottom line, the treatment goal is to lower the blood pressure. Tama ba? So yung goal-oriented tayo. Right? Okay. So at least settle for one